Hello, this is Jill Ryan from Kudamash and Associates with the next in our series of tips related to Joint Commission Top Findings. This one is related to EC 020601, which has been a top scoring standard for many years. It is related to unsafe conditions in the physical environment. And we've always really considered this kind of a catch-all, where any issues in the environment that created a safety risk to patients, staff, visitors could be scored. And just a few examples of the things that we've historically seen there and that have scored this year. And I'm quoting from actual survey activity. In the dirty utility room, it was observed that items were stored under the sink and that the cabinet floor under the sink was wet. Direct access to an electric breaker was blocked by a table stored in front of the electric breaker. It was observed that partially filled oxygen tanks were stored with oxygen tanks in the rack labeled full. And in seclusion rooms, sections of torn linoleum flooring were noted. So those are the things that we have typically found scored in EC 020601. As you all will recall, in March, Joint Commission published in JC Online an announcement that it would be increasing its survey focus and its attention to detail on risks related to suicide in the healthcare environment. So that included everything from the requirements under the National Patient Safety Goal, requirements for assessment and reassessment under provision of care, et cetera. But increasingly so, a focus on ligature risks in the physical environment. And if you refer both to that JC Online edition, as well as the National Patient Safety Goal related to suicide, as well as the Sentinel Event Alert number 56, which Joint Commission published just a bit ago, we know that continues to be suicide attempts and suicides in the healthcare setting, both in hospitals and in after having been treated in outpatient areas. So a significant serious patient safety focus, CMS, and all of the accrediting organizations have really increased survey activity and survey focus on this, and certainly rightly so. But this increased focus on ligature risk has resulted in some findings that are scoring in the highest risk areas on the SAFER matrix, on Joint Commission SAFER matrix. So in that dark red area, and some, given the circumstances, have actually triggered immediate threat to life situations in organizations. So we encourage you to really look at that suicide risk assessment, look at your, both from a physical environment standpoint, as well as your policies and procedures around assessment, reassessment, placement of patients at risk for suicide, et cetera. I encourage you strongly to review National Patient Safety Goal number 15, the Sentinel Event Alert number 56, the JC Online edition from March 1st of this year, as well as the Joint Commission FAQ, which is currently on their website, and really take a much more critical view of those areas that you have as dedicated areas for psychiatric patients, as well as areas that you might temporarily be caring for, treating, or holding awaiting placement patients who are at risk for suicide. So wanted to be sure that we really draw your attention to that significant issue, as well as reminding you about the general findings that we often see under EC 020601. I hope that you have found this helpful, and please, as always, don't hesitate to reach out to us with any questions, with any additional observations, need for more information, or just for sharing. Thank you so much, and I hope you have a good day.